Diagnosis according to Jinye imbalances. Jinye deficiency. Jinye imbalances include patterns where Jinye is weakened or stagnated, but also patterns where Jinye has transformed into dampness or phlegm. Jinye deficiency, more than being a pattern in itself, Jinye deficiency is involved in and is a consequence of other imbalances. Jinye is an aspect of yin. Yin imbalance and Jinye imbalance are like the chicken and the egg. They often lead to one another. The lack of the body fluids means that the body dries up, and this injures yin. There will be symptoms and signs such as dry mouth, dry lips, dry throat, dry skin, dry cough, constipation, and scanty urination due to the lack of moisture. The tongue will be thin and dry. The pulse will be fine. Etiology. Imbalance can arise when there has been profuse sweating, acute heat in the body, as in high fever, chronic heat imbalances, bleeding, blood imbalances, frequent and heavy urination, vomiting, and diarrhea, as well as excessive consumption of spicy food or medicine that has a spicy dynamic. Symptoms and signs: dry mouth, dry lips, dry skin, dry eyes, dry throat, dry cough, dry nose, dry mucous membranes, scanty urination, constipation, thin and dry tongue, fine pulse. Key symptoms: dry mouth, dry eyes, dry throat, dry mucous membranes, and dry tongue. The treatment principle is to nourish the Jinye. Acupuncture points: choose from lung 7, kidney 6, spleen 6, Ren 4, and Ren 12. Technique is to tonify. Explanation: lung 7 and kidney 6, open Ren Mai and Yin Xiao Mei. Spleen 6, Ren 4, and Ren 12 nourish stomach and kidney. Relevant advice: as well as following the appropriate advice that is relevant for the underlying patterns of imbalance, a person who is Jinye deficient must also make sure that they consume adequate fluids, avoid drinks that are diuretic, and avoid sweating. Jinye deficiency can be caused by the following patterns of imbalances: yin imbalance, Shi heat, imbalanced heat, blood imbalance, stomach fire, and stomach yin imbalances. Jinye imbalance can result in the following patterns of imbalances: yin shu, shui shu, and thank you for your attention.